Assalamu alaikum here. This is Dr. Khawaja Saajid with the program Bone and Health. I'm an orthopedic surgeon. I do hip and knee replacements and knee arthroscopies as well. Today I'm talking about knee arthroscopy. In other words, you can say keyhole surgery, or in simple language you can say inserting camera inside your knee joint. So we're talking about this one today. This knee arthroscopy, or minimal invasive surgery, or inserting camera inside the knee joint, or keyhole surgery is one of those revolutions in orthopedic surgery. Traditionally, if you go back a couple of decades ago, even longer than that, people used to give a big incision to open whole knee joint to repair or to do things inside the knee joint. But this kind of procedure is very simple. With this big incision, patient have to stay on the bed for a couple of days. Pain was much more. They have to take more painkiller over the longer period of time. Their mobility was slow. They could not walk on day one. Chances of infection were high. So all these things, and over the time when the science has evolved and medical field also, a lot of new things are introduced in this field. So arthroscopy was one of that. So first of all, I would like to tell you why you need, or what are the indications to go ahead for such kind of procedure. This kind of procedure usually we do for the meniscus or for the ligaments injury. Meniscus is the cartilage between your two bones inside the knee joint. And most of the time you must have heard that these kind of injuries or problems happen to the sportsmen while playing. They get the injury to their meniscus or their ACL, PCL, anterior cruciate ligament, posterior cruciate ligament is ruptured because of road traffic accident or sports injury most commonly. So these kind of procedure we deal with arthroscopy, with keyhole surgery. I perform this kind of surgery under spinal anesthesia, injection in your back, and below the umbilicus you don't feel anything. I don't give general anesthesia for that. We don't insert the tube in the mouth. This is if we do only the meniscus, if we deal only with the meniscus cartilage, it is only 30 minutes procedure. If we perform the ACL reconstruction, that's around 1 to 1.5 hour procedure. How we do is around 1 centimeter cut, only 1 centimeter on both sides of the knee joint. 1 centimeter here and 1 centimeter other side. And we insert the camera inside and we see over the computer, big screen, what is going on inside your knee joint. What is the status of cartilage of your joint? How is your meniscus? How is ACL, PCL? Everything we can just see by ourselves, and then we can deal accordingly. The beauty of this procedure, what are the benefits of this procedure? That chances of infection are very minimal. I would say 1 into 1 million. 1 into 1 million, the incidence to get the infection of the wound. Patient can walk on same day, just after a few hours. As far as spinal anesthesia effects are gone, patient can walk, full weight bearing, and same day they can go home. It's a daycare procedure actually. You come in the morning, you get it done, and in the evening time you can go home. Very simple procedure. It can give big benefit to you. But if you delay, if you keep on delaying, for example, if I just talk about the meniscal injury or even ACL injury, if you delay it, if your surgery is indicated and if you delay it, what would be the problem? Problem would be that this problem would get worse and worse, and ultimately you end up with arthritis. Once the arthritis develops, then there is very little use to go ahead for these kind of procedure, keyhole surgery to shave your meniscus or to do ACL reconstruction, because already arthritis starts. Then the different procedure you shall go ahead. So don't delay these kind of things. If your orthopedic surgeon suggests you to go ahead for this arthroscopy, keyhole surgery, for certain indication, you shall go ahead. Discuss with your doctor. What are the indication? What are the benefits will I get? What will be the problem? When will I walk? All questions, all queries, whatever you have. But this public awareness program, what I'm doing is to aware to the people that this is one of the things which we can do. We don't have to give a big incision, and you don't need to stay in hospital for 3-4 days, long-term antibiotics, painful procedure, could not walk afterwards. It's not like that. Keyhole surgery is very simple procedure. Day surgery, same day we do this kind of procedure, and a lot of problems could be solved. And you can go home on the same day and live a healthy life. On display is my contact number. I do the arthroscopies as well. In case if you want to discuss or you want to get appointment, you're most welcome. Thank you.